I'm Debbie Statler, Editor-in-Chief of Provider Magazine, and today I'm here with LaShuan Bethea, Executive Director of the National Center for Assisted Living. Welcome.
Thank you for having me.
Well, let's talk about the Long-Term Care Data Cooperative. What is the Data Cooperative?
So the Long-Term Care Data Cooperative came about because during COVID-19, the pandemic really put a spotlight on the gap in data in long-term care. And so the National Institute on Aging funded the Long-Term Care Data Cooperative, which with the goal of increasing access to data in long-term care.
What's the benefit of participating in the Data Cooperative?
So before I get into the benefit, I'd like to share a little bit more about what the Long-Term Care Data Cooperative is. It is a collaboration between providers and stakeholders. Stakeholders that come from academia, stakeholders that come from the government, stakeholders that come from the private sector as well. And so the Long-Term Care Data Cooperative uses data that comes from the electronic medical record, and it pulls that data into a format that is both accessible and usable by the provider as well as the other stakeholders. Speaking about the benefits of participation, so there are several benefits to participating. First, for the provider, it is 100% free. It is free to participate in the data cooperative, but it is also free to access that data. And so providers who do participate will be able to receive facility level reports that they can use to help them evaluate what are the outcomes, what are the benefits of programs that they may currently have employed in their communities. The other significant benefit, especially in a time where we have staffing crunches, is that if you have an electronic medical record, then there really is no additional administrative burden to participating. All of the heavy lifting to participating really falls on the electronic medical record vendor. And so from that perspective, there's a huge benefit to participating in that. You receive all of this data with very little administrative burden on the provider themselves. The other benefits to participating is addressing something that we talked about earlier, which is this gap in data in the long-term care sector. And now this makes the data available to understand things like emergency room visits or rehospitalizations or efficacy of vaccines on our population. And so that data is extremely important to understanding what decisions should we make from a policy perspective, what decisions should we make from a care and outcomes perspective. So those are some of the benefits that providers or participants could look to benefit from by participating in the Long-Term Care Data Cooperative.
Wow. Well, free, little administrative burden, and being able to have access to that data and reports, it's really powerful. Is the Data Cooperative only for skilled nursing providers?
Well, that is one of the things I'm extremely excited about. So in 2019, the Data Cooperative was launched, and the focus then was primarily on skilled nursing providers. But again, in 2024, we recognize the benefits really don't just belong exclusively to skilled nursing providers. Those benefits that we talked about earlier could also be realized by assisted living providers as well. And so in 2024, we are excited to say that we will be expanding and launching the Long-Term Care Data Cooperative for assisted living providers as well.
Well, that's great news. Well, you've talked a lot about data. Why is that so important, and how will it benefit assisted living providers who participate in the Data Cooperative?
So data is probably one of the most important pieces of information that we have to inform what should we be doing to improve the outcomes of the residents that we care for. It is extremely important that when decisions are made about our resident population, that it not be based on an isolated or an outlier case, that it not be based on a presumption, but that it be based on actual data and outcomes. And so this is really an opportunity for providers to contribute in a meaningful way to ensure that policy decisions going forward and even immediate care decisions that they're making on how they should operate and take care of their residents on a day-to-day basis are actually based on resident data. And again, not outlier cases or presumptions of what we think the outcome might be or what we think might improve resident care. And it really aligns with our our mission, the ACA and CAL mission of improving lives through solutions. And so this is really one of the ways that we're able to do that.
Well, we look forward to hearing more about the cooperative and everyone who gets to participate. Thanks for being with us today.
Absolutely. Thank you again for having me.